Hi, I'm Dr. Rasagna, dermatologist and aesthetic specialist at Akkineni Hospitals, Vijayawada. Today's discussion will cover important highlights. Please stay through and take note.
Welcome everyone to This Explainer. I am absolutely thrilled you're here. Today, we're diving into the fascinating and, honestly, sometimes a bit surprising science behind sun damage and skin aging. We're going to look at exactly what happens to our skin when it meets the sun, and more importantly, how we can protect and even heal it. Let's get right into it. But before we get down to the microscopic cellular level, I want you to ask yourself a pretty simple question. What do you think is the primary driver of visible facial aging? I mean, we all know that as time passes, our bodies naturally change, right? That's just chronological aging. But what if I told you that the simple passage of time is actually just a tiny, tiny fraction of the whole story? Okay, let's dive into this. Prepare yourself because a staggering 80% of visible facial aging is actually extrinsic. That means it comes from the outside. Specifically, it's caused by the sun. Just think about that for a second. The vast majority of what we consider getting older when we look in the mirror, it's not just inevitable time ticking away. No way. It is actually accumulated solar damage. We call this specific process photoaging. Basically, photoaging is premature aging driven by UV damage, and it is distinctly different from intrinsic chronological aging. Natural aging really only causes fine wrinkles and a very minor loss of elasticity. Photoaging, on the other hand, it actively breaks down the structure of your skin. It's not just your skin getting tired over the years, it's your skin literally being under attack by unprotected UV exposure. So here is our roadmap for today. First, the science of sun damage. Second, visible signs of photoaging. Third, the precancerous risks. Fourth, the ultimate defense. And finally, number 5, reversing the damage. All right, starting with section 1, the science of sun damage. How UV rays affect skin. To really grasp this, we need to zoom in. And this is especially critical in places like India, which gets some of the highest solar UV radiation in the entire world. So sunlight sends down 2 main types of rays. First up, UVB rays. These hit the superficial skin layers, cause your typical sunburns, and induce direct DNA mutations. Actually, UVB causes most skin cancers, but thankfully, standard window glass blocks it. Then we have UVA rays. Now, what's really interesting about this is that UVA has longer wavelengths, penetrating deep into the dermis to generate reactive oxygen species. UVA is the silent ager. It's there all day, year-round, and crucially, it is not blocked by standard glass. If you're sitting near a sunny window right now, UVA is definitely reaching your skin. So, what exactly happens when those rays penetrate the skin? Well, UV exposure essentially flips a switch in your cells, activating an enzyme called matrix metalloproteinase. Yeah, it's a mouthful, but its job is simple and, frankly, destructive. It literally breaks down the skin's structural foundation, just tearing right through your dermal collagen and elastin. This right here is the exact mechanism of structural aging. Moving on to section 2, visible signs of photoaging. Structural collapse. Without that crucial collagen and elastin foundation holding everything up, the skin structurally collapses. This results in deep wrinkles, particularly around the eyes, mouth, and forehead. We also see solar lentigines, which you probably know as liver spots. Interestingly enough, the source notes that these are the absolute most common sign of photoaging in Indian skin over age 40. You'll also see uneven, splotchy pigmentation because the melanocytes get damaged and start acting irregularly. The skin can develop a leathery, rough texture, damaged superficial blood vessels known as telangiectasias, and finally, actinic keratosis. This is where the skin actually takes on a yellowed, coarsened appearance simply because it's lost its normal internal structure. Which brings us to section 3, the precancerous risks, cellular mutations. Now, we have to elevate the stakes a bit from purely cosmetic concerns to some pretty serious medical imperatives, because this UV damage actually mutates cells. And this leads us to actinic keratoses, or AKs. These are rough, scaly, sometimes red patches that pop up on chronically sun-exposed skin. So the crucial point here is that these aren't just dry skin, they are the direct result of cumulative UV-induced p53 mutations in your skin cells. And because of these mutations, AKs are officially classified as precancerous lesions. They're basically precursors to a type of skin cancer called squamous cell carcinoma. Now, while the risk of a single AK progressing to cancer in any given year is actually quite low, the cumulative risk is what really matters. If you have multiple lesions, that risk goes up, which necessitates medical intervention. Fortunately, there are some highly effective evidence-based treatments available. These include freezing them off with cryotherapy, applying topical chemotherapy creams like 5-fluorouracil, using immune modulators like imiquimod or ingenoma butate, or even photodynamic therapy, which is fantastic if you need to treat an entire field of skin with multiple AKs. All right, let's pivot to Section 4, the ultimate defense, sun protection. When it comes to daily broad-spectrum sunscreen, and yes, you want SPF 50 or higher, you generally have two choices. First, mineral sunscreens. These use zinc oxide or titanium oxide to sit right on top of the skin and physically reflect UV rays. These are absolutely fantastic if you have sensitive, rosacea, or acne-prone skin. On the flip side, we have chemical sunscreens. These use ingredients like oxybenzone or avobenzone to absorb UV rays and convert them into heat. Now, these can sometimes irritate really sensitive skin, but they often rub in way more transparently. Whatever you choose, remember that UVA ray we talked about earlier? Make sure your bottle says PA 4++ to guarantee you're getting maximum UVA protection. Having the right sunscreen is only half the battle, though. How you use it is the other half. So here is your evidence-supported sun protection tutorial. Step 1, apply that broad-spectrum sunscreen 15 to 30 minutes before you even step outside. Step 2, remember that behavior matters just as much as lotions. Seek shade and wear UPF-rated clothing or wide-brimmed hats, especially during peak UV hours from 10 a.m. to 4 p.m. Step 3, reapply your sunscreen every 2 hours if you're outdoors. Guys, sun protection is, without a doubt, the single most proven anti-aging intervention in existence. Let's move to Section 5 and see how this builds. Reversing the damage. Medical interventions. When it comes to actually treating existing damage, the undisputed heavyweight champion is topical retinoids, specifically tretinoin. It is the most evidence-supported agent for photoaging reversal, hands down. It literally forces the skin to stimulate new collagen and increases epidermal cell turnover, which visibly reduces wrinkles and those solar lentigines we mentioned. Then we have daily vitamin C serum worn right under your SPF. As an antioxidant, it acts kind of like a shield, preventing that UV-induced oxidative damage while reducing pigmentation. Finally, alpha-hydroxy acids, or AHAs, like glycolic or lactic acids, provide chemical exfoliation to beautifully improve skin texture. And it's definitely worth noting, providing these targeted photoaging treatments and skin cancer surveillance is exactly the kind of expert management offered by dermatology teams, like those mentioned at Akkineni Hospitals in our source material. But if topicals aren't quite enough, advanced professional procedures can target those specific visible signs we cataloged earlier. Superficial, medium, or deep chemical peels can clear away damaged layers. Intense pulse light, or IPL, is fantastic for clearing up uneven pigmentation and zapping those damaged blood vessels. For deep structural wrinkles, fractional CO2 or erbium lasers actually resurface the skin. And laser toning can specifically target and lift those really stubborn solar lentigines. And this brilliantly illustrates the core thesis of everything we've looked at today. Check out this quote. Sun damage is cumulative, progressive, and largely preventable. Consistent daily sun protection is the single most effective long-term skin health investment. It really all comes down to consistency. So I leave you with this final thought. You now know the science. You know that 80% of facial aging is actually in your control. So what does this all mean? The question is, are you ready to make the ultimate investment in your skin today? Grab your SPF, find some shade, and take control of your skin's health. Thank you so much for joining me on this explainer, and I'll catch you on the next one.